Hello, everyone, and welcome to the Caregiver's Guide to Alzheimer's and Dementia. My name is Winslow Dixon. I'm a published author, a holistic health practitioner, and geriatric specialist practicing in Alzheimer's and dementia for the last 10 years. So I'm here on ZubiaLive, and we're going to discuss the medications and treatments used in Alzheimer's disease. So let me just put out the disclaimer that I'm not a doctor and I'm not here promoting or anything like that, any medications. We're just here to discuss options that you can take to your appointment so you can be a little more educated and informed. So let's first discuss the top medications that are Alzheimer's. There are only two medications that are specifically written by the FDA and approved for Alzheimer's. And these are called, well, the first type is called cholinesterase inhibitors. And the second type is brand name Namenda, which is memetine, which is the generic name. But these medications are the only ones that the FDA has approved specifically for Alzheimer's disease. You may know these medications by their brand names. Aricept is a pill that is prescribed once daily for the treatment of Alzheimer's disease. Exelon is also another one of these medications, and this medication specifically is used as a patch, and it's pretty much used in the later stages of Alzheimer's and those that have trouble taking medications. It's just a patch that they can put on their skin, and the medication goes in transdermally. So that's kind of a great option for those in the later stages. But Namenda is also another pill that I mentioned that is prescribed for Alzheimer's disease. And those are basically the only ones that treat that. There are also some other medication classes that are used to treat the symptoms of Alzheimer's disease. These are psychotropic medications such as benzodiazepines. Some antidepressant medications such as SSRIs are also used to treat the symptoms of Alzheimer's disease. So the big question that a lot of caregivers have are, should I give medications to my Alzheimer's patient? Should I give medications to my loved one? And I know that we all have these horror stories that we've heard about the nursing home people just doping all these medications on these people, and they're just sleeping all the time and they're all doped up. And I'm here to tell you that that is not the norm. As someone who's given medications in assisted living and Alzheimer's for the past 10 years, I can tell you that there are many parameters and safeguards that make sure that your loved one are taken care of and they're not just doped up. That being said, I know that a lot of family members are hesitant to give medications such as benzodiazepines and such as SSRIs because they think, oh, I don't want to just put them on something that will, make them out of this world or change their mind or anything like that. But these medications are there to help your loved one manage the difficult symptoms of Alzheimer's disease. Alzheimer's is a brain disease. It is a progressive brain disease that impacts their ability to communicate. It impacts their ability to feel rational emotions, and it can impact their ability to orient to reality. And these medications are there to help calm them. They're there to help keep them in a good mental place, and they're there to help your loved one. And unfortunately, some of them do have side effects of drowsiness and things like that, which is why the right dose is appropriate. We don't want anyone falling asleep or being an extra fall risk because of medications, but we also use these medications to inhibit those fearful reactions. And if we see a patient that's getting very fearful and very disoriented, not knowing where they're at, we give these medications to help them with that disease symptom. So I'll give you an example. We had a resident, and I won't say her name, but she became very fearful at night. Sundowning is unfortunately a symptom of Alzheimer's disease, and that's where at nighttime they get really disoriented and they can become so confused and they become fearful. And with this specific lady, we had to work with her physician to give her more medications at night because the first shift team would give her all her PRNs, which are, the medications, the benzodiazepines that were prescribed. And then at night when she really needed them, instead of being comforted, she was calling out at night and very fearful and afraid. And we had to send a CNA to sit with her. And when you're understaffed, that's kind of difficult. So not that we mind doing that. And, certainly if your loved one is in a facility, you want them to take that extra step, and you're going to want to have CNAs and nurses that will go in there and sit with them if that's needed. But that being said, we use those medications to try to inhibit those fearful moments, to try to treat those symptoms. And with the cholinesterase inhibitors, there's evidence that they slow the progression of the disease. There's evidence that they can kind of slow the degradation of the synapses in the brain. And those medications are used to help slow the progression and manage the symptoms. So I don't want anybody watching this being afraid to put their loved one on medication. That being said, it's always good to work with a physician that knows your specific case, that is educated on how to have the least side effects and the maximum benefit of any medication. That's any disease. You're going to want maximum benefit with minimal side effects. So these are just options you can discuss with your physician. As far as alternative treatments, there are many supplements that have been used to treat the progressive disease. Some examples are coral calcium, omega-3 fatty acids, coconut oil, and herbs such as like ginkgo biloba and things like that. These, of course, are holistic means, and so there's not as much research to prove or disprove the effectiveness, which is to say, it's not that it doesn't work, it's that there's just not the research behind it that has said it works or not. And everyone is different. So there's no harm in trying something just to see if it comforts your loved one. There are a wide range of alternative treatments that have been used: music therapy, alternative therapy, light therapy, even the use of essential oils I have seen in Alzheimer's units. We have utilized, lavender for calming and things like that, peppermint oil if there's any nausea, things like that. It's just something that you can provide that's not a medicinal means. Like I said, it being holistic, there's really not a green light or red light of whether it works or not. It's just trial and error. And if you think something could help your loved one, such as an essential oil or music therapy or anything like that, quality of life is the goal. So I don't want you watching this to put, your mind in a box like no medications, no alternative treatments, it has to be this, this, and this. Everything works differently for some people. And lavender oil might be great for one person, but it might not even work for another. Coral calcium might work great for one person, but might not work for another. You have to work with your healthcare team to figure out options that are going to work for you. Quality of life is the goal, and I can't stress that enough, that even with a daunting diagnosis of Alzheimer's disease, we really need to try to give our loved ones and our patients and our residents the best quality of life possible. Still give them the opportunity to have enjoyable moments, to enjoy their lives, even having this devastating illness. That's the goal. Quality of life is the goal. And if it takes a combination of an alternative therapy and a medication to do that's okay. Like I said, everyone is different and no two patients are the same, especially with Alzheimer's. It impacts different parts of the brain and different people. And it's just a very random disease and how it affects people. Some people really have a lot of cognitive impairment and some people really last till their very last days mentally. It just very depends on that specific person, genetics, all of those things play a role. But the point is that you need to work with your healthcare team and see what options are out there, both medicinal and alternative. So I hope that these tips have given you some options to discuss with your healthcare provider. Thank you for tuning in. Our final installment of this series is going to be discussing how to care for your loved one at home, and we will be filming that later this week. So again, thank you for tuning in. My name is Winslow Dixon, and this has been the Caregiver's Guide to Alzheimer's on ZubiaLive. Thank you.